With the further easing of pandemic restrictions, the government has been rolling out its COVID-19 vaccination program for minors who are 12 to 17 years old. It's part of a bigger plan to safely reopen schools that have been kept shut since the start of the pandemic. Now, the target is to inoculate 80% of the younger population by the end of the year. Can we do it? And what do we know so far about this initiative? We'll find out more here on MedTalk Health Talk, only on CNN Philippines. We're here to build a healthier future for you. I'm Dr. Freddy Gomez. The move to vaccinate minors is a result of plans to gradually reopen schools for limited face-to-face classes. Now, to help us with today's discussion, let's welcome Dr. Ronjean Solante, who's the head of the Infectious Diseases and Tropical Medicine Department of the San Lazaro Hospital and Medical Center and member of the Vaccine Expert Panel. Also with us is Dr. Ana Lisa Ong Lim, who is the chief of the Pediatric Infectious Disease Division of the Philippine General Hospital and a member of Healthcare Professionals Alliance Against COVID-19. Thank you once again for being here on MedTalk Health Talk. Always glad to have both of you on the show. Now, let me start with this question. I'll ask Dr. Jean, what have been the results so far of studies out there that are making way for the vaccination of the younger population dito sa Pilipinas?
These are the two vaccines that are being currently used for the rollout in children, 12 to 17, Moderna and Pfizer. And both of these have very high efficacy. And I think that paves the way for the approval. They were given an EUA in other countries, and that also paved the way for Philippine FDA EUA that we can use this for this age group of 12 to 17 years old.
Now, Dr. Jean, bakit 12 to 17 lang ang age limit? Bakit yung mga younger than that hindi eligible for vaccination? A lot of parents or a lot of reports now come na meron pa rin na-infect na below 12 years old. Paano na ngayon sa mga batang gano'n? Yung mga parents na worried about their kids who are younger than 12?
The priority here is really to vaccinate as many as the children, younger than the 12 years old. But I think based on the data that they're presenting, they prioritize first the 12 to 17 because this is more or less in terms of the weight and in terms of the immunogenicity among when comparing it with the 16 to 25 years old. Medyo magkahawig lang to, no? So they prioritize the 12 to 17 years old. Okay? And if you notice, the dosage also is the same as that with the adult. But if you look at the 11 to or the 5 to 11, it's really a different group of children already.
Dr. Ana, what do we know so far when it comes to side effects? Pareho lang ba ito dun sa mga adults na nabigyan ng vaccine?
Most of the reports, Doc Freddy, are still showing that the adverse effects following immunization are as what we see in adults. Yung pain in the injection site, swelling, redness, fever, sometimes body aches and pains are still the predominant adverse events being reported. Although I have to say na after the rollout for the 12 to 17-year age range, syempre meron tayong global adverse events reporting system na nakapick up ng very rare cases of heart inflammation or what's called myocarditis. Okay. In fact, yung sa database ng US, all the way through June or July of 2021, after 300 million doses, ang rate is 0.0004%. So, napakakonti. But of course, syempre, binabantayan pa rin yan.
Maraming nagtatanong, is there even a slight possibility na yung anak nila, given the COVID-19 vaccine, pwede ba nilang makuha ang COVID-19 sakit dito sa vaccine?
Ang ginagamit nating mga bakuna globally against COVID-19 are what we call the inactivated vaccines. Ang laman niyan, dead virus or parts of the virus na hindi naman mabubuhay pag tinurok na natin sa katawan. So when you get vaccinated, the outcomes expected are protection against severe critical disease, and lowering the risk of death.
The vaccination process for minors is very similar with the adult group, except that they have to present a signed consent form. They must also be with their parent or guardian on the day of vaccination. Dr. Ana, please walk us through the registration process. At pwede bang magpabakuna ang mga walk-in, yung mga hindi nag-register beforehand?
Siguro medyo maninibago ang mga kababayan natin dito sa prosesong to kasi when we go get our vaccinations, there are no documents being signed naman eh. The fact that you're there in the clinic asking to be vaccinated is taken to be your consent. Pumapayag ka kasi nandoon ka nga. Pero dito, dahil nga emergency use authorization, kahit sa adults, pinagpipirma tayo ng consent, ganun din sa mga bata. Pero ang pipirma ay yung magulang dahil wala pa sa legal age yung bata. Ang hinihingi natin sa bata ay yung assent. Pumapayag din siyang mabakunahan. Most LGUs will ask for kids to be scheduled because we want to manage crowds.
Right.
Yun kasi yung nagiging source ng pagkakahawaan hindi yung bakuna, yung proseso ng pagbabakuna ang problema natin. But I would encourage our viewers to be alert for any announcements from their LGUs because in some cases, pumapayag nga ng walk-ins. You're right to mention that, no? At baka naman ma-accommodate sila.
Okay. Now, Dr. Ana, when it comes dito sa medical certificate na required for vaccination ng mga minors, what should the parents know about this? Dapat ba hawak-hawak nila ito? Will they be turned away kapag wala silang medical certificate from their doctor?
Part ng rollout natin focused on 12 to 17s with comorbidities. Doon hininga ng medical certificate because we wanted to make sure that the people who were presenting to the vaccination centers were truly the 12 to 17 A3s o yung with comorbidities. Pero ngayon na nag-expand na tayo ng rollout for normal 12 to 17s, ang kailangan lang talagang magdala ng medical certificate ay yung may comorbidities para lang alam nung team na magbabakuna sa kanila kung ano yung kondisyon ng pasyente. Pero kung healthy yung bata, hindi hinihinga ng medical certificate.
Now, Dr. Jean, pinag-usapan natin to earlier. When do you think will be the plan for the Philippines to finally have that below 12-year-old group na pwede na rin silang bakunahan?
Sa ngayon, wala pang nag-apply for an EUA for the extended or expanded indication sa mga bata. No? So we would expect na later on siguro, Pfizer will do apply for that because that's the same process they did when the vaccine was approved for the 12 to 17 years old in the US. Nung na-approve na to, nung nakita doon sa data na maganda rin ang 5 to 11 years old. And siguro, once na mag-file sila ng EUA, then we can use that.
Now that we know about the vaccine rollout for minors and the side effects, how should parents and their children prepare? We'll have the answers for you after a short break. You're watching MedTalk Health Talk, where your health always comes first. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. We're together in health. Adults make up the large majority of COVID-19 cases, but this doesn't mean that children aren't vulnerable. A vaccine will lower their chances of serious complication. In addition to that, if many of them get vaccinated, the chance of us reaching herd immunity goes up. Let's go through some of the more important aspects of pediatric vaccination. Dr. Ana, first, let's explain again kung ano yung mga bakuna na approved para sa mga bata ngayon.
So this will be the Pfizer vaccine as well as the Moderna vaccine. And both belong to the same platform. We call them the mRNA vaccines.
When it comes to these vaccines, itong dalawa lang ang pwede. Does that mean, does this have any significance to the safety when it comes to the kids, itong dalawang brands na to? What about the parents who think about sila na bakunahan with this brand? Can their child be given the same brand that they received as well?
For some of the other platforms, the pediatric trials are still either just starting up or being completed. So of course, we cannot naman give vaccines that don't have an EUA, even if the parents prefer it, kasi we don't have the data to support that this will be safe or efficacious for the kids. So for now, granted that we know that the disease is spreading in our communities and we want for the kids also to be protected since they have the opportunity, then we should take the chance and be vaccinated na.
Now, Dr. Jean, marami ang mga parents ang nagtatanong. One of the reasons rin sa mga hesitancy nila to have their kids vaccinated, their question is, how did the FDA determine yung safety and effectiveness ng mga COVID-19 vaccines, itong 2 brands of COVID-19 vaccines na pwedeng ibigay sa mga bata?
When we evaluated these vaccines, the number one priority is always how safe these vaccines are. No? And in fact, in the phase 2, phase 3 trials of the Pfizer and Moderna, those were the main objectives. And they found out that it's really safe, it's tolerable, and that paved the way for the approval. You may have adverse reaction, but the adverse reaction still are very low, and most of them are the ones that you see also in adults. But in terms of the more severe, serious adverse reactions, especially for the mRNA, which is myocarditis, it's really rare at this point in time. So we must, I think, emphasize that these vaccines are really safe before it was approved, and because of that, most countries now are also giving vaccines with this age group.
For the parents' peace of mind, are there any windows? Pwede bang ma-overdose ang isang bata when it comes to these vaccines or any safety requirements such as that?
Kadalasan nakikita natin ang mother are very conscious about the dosage, no? Kung hindi ba mag-overdose. Now, again, balikan natin itong mga dalawang clinical trial, no? And determining the dose was very important. Primarily that it is safe and it is less reactogenic, no? Ibig sabihin, less ang side effect. At the same time, without getting the benefit, which is the efficacy of that particular vaccine.
Meron bang grupo ng mga bata where the parents should be aware who shouldn't get inoculated?
For as long as medically stable, okay kang mabakunahan. Ganon din sa mga bata. Even for those with comorbidities or immunocompromising conditions, we actually encourage vaccination. Kasi kung sila nga ay mahawaan, sila yung napakataas ang risk na ma-ospital o mamatay. So for as long as they're medically stable, okay to vaccinate.
Dr. Ana, let's talk about the safety ng mga children in getting the COVID vaccine as well as their vaccines, yung mga usual vaccines sila for preventable diseases. Alin ang dapat mauna? What's the time frame in between that parents should be aware about?
We actually have data from abroad that simultaneous or co-administration of vaccinations is allowed. However, our local practice has been very, very conservative, and we continue to advocate for a 2-week interval between doses of COVID-19 vaccine and any other vaccine. And this is really just because we want to have less worries, less concerns about any interactions or adverse effects following vaccination and being able to track them well.
Getting vaccinated and following health protocols will protect you from the virus. After a short break, we'll revisit these practices that work. This is MedTalk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines, where your care comes first. Dr. Jean, review natin para sa mga viewers yung mga health protocols. Lalo na holiday season, what should our viewers know about the proper health protocols?
You have to wear your face mask. Paglabas mo sa bahay, talagang walang tanggalan ng face mask yan, especially when you are in the workplace. And then, as much as possible, we also have to avoid crowding. No? Although, pinababa na ngayon ang alert level natin, so there will be more capacity sa mga workplace or sa mga public transportation. The more we should be compliant with the health protocol, face mask. And I think for me, personally, I would still advocate the use of the face shield, especially in closed spaces.
Dr. Jean, ngayon na nakikita natin na pababa ang trend when it comes to new infections on COVID-19, you still would advocate na we shouldn't let our guard down?
I think ang nakikita natin ngayon, pag sinabing binaba na yung alert level, ang mga tao mas lalong naging kampante. No? So they thought na everything is okay, pwede nang magtanggal ng mask, pwede nang magkipaghalubilo, maski sa ano. No, that should not be the way, that should not be our attitude at this point in time. Remember, the virus is still here. It's not yet zero case, and we're dealing with the most highly transmissible virus, which is the Delta variant. And I think we should always be reminded of these health protocols.
Dr. Anna, in line with that, what do you think about a lot of the parents? Syempre, matagal na nilang hindi nila na ilalabas ang anak nila, hindi na ipapasyal. And lately, we see a lot of parents bringing their children to malls, to public establishments and whatnot. What is your opinion on this?
I have to admit, nung nakita nga natin nung nakaraang weekend, diba, that was the first weekend after which the restrictions for minors were lifted. Talagang ang dami-daming bata. And unfortunately, marami ding mga bata na hindi talaga makasunod dun sa ating minimum public health standards, pagsusuot ng mask o pag-iwas sa dami ng tao. So siguro bilang mga magulang and guardians, hindi naman natin sinasabing wag nyo nang ilabas yung mga bata. Pero I think dapat kaya nating utakan yung virus eh. We have to be able to outsmart it and think, where should we go where the virus is less likely to be present? So that means dapat hindi sobrang dami yung mga ibang taong makakasama ninyo at mas maganda kung open space para hindi kulob at hindi nag-iipon yung virus at mas maganda rin kung mas kaunti ang tao na nasa paligid, no? So if you keep that in mind, then it's entirely possible to have a safe activity outside of our homes.
Now, as schools reopen, a lot will depend on teachers to ensure that children will be able to continue their education in a safe and healthy environment and make up for the knowledge and skills that may have been lost. Dr. Jean, for both teachers as well as students, what are some of the do's and don'ts inside the classroom that you would advise or recommend?
Dapat bago tayo mag-open ng classes, no, yung face-to-face, both the teachers and the student should be vaccinated na, no? Importante yan. And then I think schools are now preparing also in terms of the ventilation, no, sa mga rooms, and that's very important also kasi alam naman natin na when you open up and then you tend to accommodate more of this in the classroom, there's a possibility that you cannot really prevent, no, yung longer interaction. So one is ventilation, and I think the school should have a very good protocol in terms of the health protocols, health measures, screening, and should also be in place once the schools will be open for the face-to-face.
Ang Delta variant ang pinaka-predominant variant dito sa Pilipinas ngayon. But there are some variants of this as well that are being a cause for monitoring or even concern. What is the latest news? What should parents know about this? And could you explain to us also where these variants come from? Bakit sila dumadami? Are these coming from people who are vaccinated or those who are unvaccinated?
It's a Delta variant that's really the most dominant here in the Philippines. And we know that variant usually exists because of constant and ongoing transmission in the community. There are people that are what we call immunocompromised that are also vulnerable, where most of this variant can really or readily mutate. So the bottom line here is if you are vaccinated, you stop the transmission, you have an antibody, then even if you get the infection, your risk of that variant mutating in a vaccinated will be really, really low compared to an unvaccinated individual. So the bottom line here is that we need everyone to be vaccinated to lessen the transmission and to lessen the risk of these mutations.
Now, Dr. Anna, what advice can you give naman sa mga parents, and how can they prepare their children mentally as well as physically before going back to school? I'm sure maraming parents may be excited but hesitant as well.
They have to think 2 or 3 steps ahead. Paano ba natin masisiguro na hindi mahahawaan yung bata? So tama, yung bakuna kung pwede na. Tapos, kailangan din nilang i-orient yung kanilang mga kids kung ano ba yung purpose nung ginagamit ng mga PPE and why it's necessary and how to behave, no, inside the classroom to decrease their risk of transmission. And then siguro, they may also want to coordinate with the school officials to find out ano po ba yung ating protocol or SOPs kung sakasakaling meron tayong ma-detect na positive case, anong gagawin sa mga bata.
What do you think parents should do if their child is exposed nga to someone with COVID-19 in their school?
Let's expect the worst case scenario so we're ready for it. So gusto natin na merong parang some kind of contact tracing system yung school community. Paano ba inire-report ng mga students kung meron silang positive case or may positive case at home? Tapos, paano pinapaalam sa mga close contacts or classmates ng bata? And then, of course, alam naman natin na pagka naging high-risk close contact ng isang individual, meaning hindi siya nakapasa dun sa apat dapat standards, di magpa-quarantine dapat yung batang yun. And that means 14 days out of the school setting, and also making sure that the home environment is set up to be able to handle a quarantine situation.
And with that, thank you very much to infectious disease specialist Dr. Ronjin Solante and Dr. Ana Lisa Ong Lim. Always a pleasure to have you on the show. Maraming salamat sa inyo. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and this has been MedTalk Health Talk on CNN Philippines.